have you ever heard of a single medication that can treat schizophrenia, help with depression, and manage Tourette's disorder? I mean, it sounds almost too good to be true, right? But that's exactly what aripiprazole does. So today, let's dive into this incredibly common, but really misunderstood medication. And that really is the central question, isn't it? How on earth can one single medicine be effective for such a wildly different set of conditions? Well, the answer is pretty fascinating, and it all comes down to a unique mechanism that sets it apart from almost everything else out there. So, let's start with the basics. What exactly is aripiprazole? You've probably heard of it by its most common brand name, Abilify. At its heart, you can think of it as a really versatile tool designed to go in and help rebalance the brain's incredibly complex chemistry. Now, on paper, it's classified as an atypical, or second-generation, antipsychotic. And its main job, like we said, is to tackle imbalances in the brain. But the real story here, the thing that makes it so special and what we're going to focus on, is its totally unique mechanism of action. Then the best way to understand this unique mechanism is with a simple analogy. See, instead of thinking about brain signals as a simple on or off light switch, I want you to imagine aripiprazole as the brain's dimmer switch. Let's break down exactly what that means. The fancy scientific term for this dimmer switch effect is partial agonism. Now I know that sounds super complex, but the idea behind it is actually really elegant. It just means the drug doesn't slam the brakes or floor the gas on a brain receptor. Instead, it can give it a little nudge, or it can dial it back a bit, all depending on what the brain needs right then and there. It's all about stabilizing. So here's the difference in a nutshell. Most medications are like that regular light switch. They either completely block a receptor or they fully activate it. It's an all-or-nothing game. But aripiprazole, our dimmer switch, is so much more sophisticated. It can turn the activity up just a little or turn it down just a little, fine-tuning the whole system to get it back into that sweet spot. Okay, so let's look at how this works. In parts of the brain where there's just way too much dopamine, which is what can cause things like hallucinations, aripiprazole steps in and acts like a blocker. It kind of sits on the receptor and prevents that overwhelming signal from getting through. It basically just turns the volume down. But here's where the magic really happens. In other parts of the brain where dopamine levels are too low, which can cause symptoms like social withdrawal or a lack of motivation, aripiprazole does the exact opposite. It gives that same receptor a gentle little push, just a mild stimulation, to turn the volume back up, just enough to get things working properly again. Okay, so that's the theory behind it. Pretty cool, right? But how does this dimmer switch concept actually play out in the real world for patients? Let's take a look at how this unique mechanism translates into actual treatments. And this is where you really start to see its incredible versatility. We're talking about FDA approval for schizophrenia, bipolar disorder, as an add-on treatment for major depression, for irritability and autistic disorder, and even for Tourette's. That's a huge range, and it's all possible because of that unique stabilizing effect. Schizophrenia is the perfect example of this dimmer switch in action. You see, the condition involves both positive symptoms, like hallucinations from too much dopamine in some areas, and negative symptoms, like withdrawal, from too little dopamine in others. Aripiprazole is amazing because it can go in and tackle both issues at the same time, turning the volume down here and turning it up over there. Another really common use is as an add-on therapy for depression. So picture this. Someone's on a standard antidepressant, but it's just not quite getting the job done. A doctor might add a very low dose of aripiprazole to their regimen. That little bit is often enough to boost the effectiveness of the main medication and make a huge difference. It's like giving that first drug a really smart assistant. But, of course, any medication that is this powerful is going to have some risks. You know, achieving this kind of delicate balancing act inside the brain can come with side effects, and it is so important that we understand what those are. So the side effects can range from pretty common things like headaches or drowsiness to much more serious, though thankfully rarer, risks that need immediate medical help. We're talking about things like big metabolic changes that can affect your weight and blood sugar, or movement disorders like tardive dyskinesia. And this, right here, is why being closely monitored by a doctor is absolutely crucial when you're on this medication. Okay, there is one side effect that we have to talk about specifically because it's fairly common and can be incredibly distressing. It's called akathisia. And this isn't just about feeling a little fidgety. People describe it as a profound, intense inner restlessness, a feeling that you physically cannot stay still. If you or anyone you know experiences this, it's something to report to a doctor right away. And finally, we have to address the most serious caution from the FDA. It's called a black box warning. It states very clearly that using this drug in elderly patients who have dementia-related psychosis puts them at an increased risk of death. It is a really stark reminder that this is a very specific tool for very specific conditions, and it is absolutely not approved for this particular use. So, after all that, when you put it all together, what's the big picture here? Well, aripiprazole isn't some magic bullet, but it is, without a doubt, an incredibly powerful and remarkably precise tool in modern medicine. So what are the most important things to remember? First, that unique dimmer switch action is the real secret sauce. It's what makes it work so well for so many things. Second, because it's so powerful, it demands respect. That means careful, personalized dosing and constant monitoring. And finally, and this is so important, this medication has to be managed with a doctor, and you should never stop taking it suddenly without their direct supervision. You know, aripiprazole was a genuine revolution in how we approach brain chemistry, and it leaves us with this really fascinating question to think about. As our maps of the human brain get more and more detailed, what will the next generation of these dimmer switches be able to do? What will they look like?